Good evening. My name is Dr. Claudia Huegel, and if you're joining me tonight, you're interested in hearing about the relationship between obesity and cancer. Many of you who may know me, Dr. Claudia Huegel from Shrewsbury, New Jersey, know that I'm a bariatric or obesity medicine physician who not only wants my patients to look good and feel good by losing weight, but also to prevent and treat, and in some cases even cure, disease. So tonight I want to talk about something very near and dear to many of our hearts, whether we've been touched by it on a personal level or by family members or friends, and that's cancer. And unfortunately, there is a very strong relationship between obesity and cancer. In fact, in 2014, there was a study that showed that obesity was the cause for a whopping 40% of cancers in the United States. And another really very sad statistic is that obesity is more likely to cause death from cancer. In fact, obesity has now exceeded smoking as a major risk factor for many cancers. These are really alarming and scary statistics. What are some of the cancers that are commonly associated with obesity? Well, the most common are those of the GI tract, such as stomach cancer, colorectal, gallbladder, and pancreas, and kidney cancer. But one of the most common cancers associated with weight is the cancers of the female reproductive tract, such as breast cancer, ovarian cancer, and endometrial cancer. The prospective studies collaboration analysis, which was a huge prospective study that was published in 2009 in the journal Lancet, looked at studies in Western Europe and North America and showed that the risk of these cancers increased exponentially with every 5 kilograms per meter squared of BMI above 25, which is normal. So in other words, the higher your BMI, the more likely you are to develop cancer. So what are some of the mechanisms or some of the ways that obesity leads to cancer? So for the reproductive cancers, the female reproductive tract cancers such as breast and endometrial and ovarian are due to an increase in estrogen production inside the fat cells themselves. Also, when you're obese, you tend to have a greater circulating leptin level. Now, leptin is a hormone that actually is part of the hunger and fullness or satiety pathway. But unfortunately, in obese people, you often have high levels of leptin, which should be a good thing, but your brain just doesn't recognize that leptin. So high levels of leptin can actually contribute to cell growth. And in addition, people who are obese also have decreased adiponectin levels. Adiponectin is also a hormone that contributes to decrease in proliferation or cell growth. And those levels are often decreased in people who carry extra weight. In addition, fat cells affect other tumor growth factors. And more recent research in the last decade or so has shown that a chronic low level of inflammation contributes to obesity or is found in obesity, but also contributes to cancer. And also gut flora is different in those who carry extra weight, and that gut flora is more likely to produce excess cell proliferation or cell growth. And finally, there is something called insulin-like growth factor, and there's increased circulating IGF or insulin-like growth factor in those who carry extra weight, which also contributes to increased cell growth. So at Metamorphosis Physician-Assisted Weight Loss, we have treated over the last 8 years many patients who've both suffered from cancer or trying to prevent cancer because maybe they have a family history, and found that their risk of recurrence was significantly less once they lost weight. In fact, many area oncologists, both in our community and in New York City, recognize the work that we do and refer regularly to us to help their patients. There's, in fact, the single best thing that you could do to prevent recurrence if you've had cancer or to prevent the development of cancer is to reach an ideal body weight for your body. So don't wait. Give us a call. Our phone number is 973-220-3162. And we're located on Broad Street in Shrewsbury, New Jersey. You can check us out on our website. which is www.medimorph, medimorph, weightloss.com, and check us out, give us a call, or comment below, share your story with us. Let us know if you've had a bout with cancer and if you're looking for help with reaching your weight loss goals. And if has your oncologist been telling you that you need to lose weight, well, then we are the perfect solution. And we not only help you lose weight through managing your eating, but we use the 4 pillars of obesity medicine treatment, which is a healthful diet, exercise or physical activity, and we help you to increase your physical activity no matter what your limitations are. We do use weight loss, FDA approved weight loss medications where appropriate. And the most important thing is behavioral counseling, and we have a very comprehensive program in place, including a behavioral counselor that can help you not only lose the weight but keep it off forever. So please give us a call, or like I said, comment below, share your story, reach out to us, and start your journey on preventing cancer today. Have a great night.